My name is Jennifer Metcalf. I am a student in the nursing program at Indiana State University. This presentation is for Nursing 444 Community Health Nursing. The part I am focusing on is everyone in the community. I want everyone to recognize the signs and symptoms of diabetes and how to treat or manage diabetes. Participants of this presentation will be able to 1. State what diabetes is and who is at risk of having it. 2. State the different types of diabetes. 3. State which type of diabetes is preventable and how to prevent it. 4. State the signs and symptoms of diabetes. 5. State the treatment management of diabetes. 6. Know when to see a doctor. And 7. The complications of diabetes. Please complete the pretest that I have attached in the comments below before viewing the presentation. Then after the presentation, complete the test again to see how much you have learned. Also posted in the comments is a brochure that includes the summary of this presentation and the reference list for more information. What is diabetes? Diabetes is a disease that affects your blood sugar level. Blood sugar is also called glucose. Glucose is an important source of energy for the body and is made by the liver and also comes from the food you eat. Insulin is a hormone that is made by the body and lowers the amount of glucose in the bloodstream. There are different types of diabetes: type 1 diabetes, type 2 diabetes, prediabetes, and gestational diabetes. Prediabetes. Prediabetes are blood sugar levels are high, but not high enough to be diagnosed as diabetes. It is possibly reversible with changes in diet and/or exercise. Prediabetes often leads to type 2 diabetes. Gestational diabetes begins during pregnancy in some women, may or may not go away after baby is born. Pregnancy hormones make the body's cells resistant to insulin. This can lead to the possibility of too much glucose in the blood. Risk factors are age, family and personal health history, weight, and race. Type 1 diabetes can begin at any age, but usually starts in children or adolescents. The exact cause is unknown, but it is possibly caused by genetic susceptibility and environmental factors. Part of the cause is the immune system attacks the cells that produce insulin. This decreases the amount of insulin available, which causes sugar to build up in the bloodstream. Weight is not a factor of type 1 diabetes. Type 2 diabetes. Type 2 diabetes is more common than type 1. It can begin at any age, but usually begins after age 40. Cells are resistant to insulin and sugar builds up into your bloodstream. Weight is a factor, but not everyone that is overweight has diabetes. Genetics, race, age, and environmental factors play a role in if someone will get diabetes. Signs and symptoms of type 1 and type 2 diabetes. These include increased thirst, extreme hunger, frequent urination, unexplained weight loss, presence of ketones in the urine. Ketones occurs from breakdown of muscle and fat when there is not enough insulin present. Fatigue, irritability, blurred vision, slow healing sores, and frequent infections such as infections of the gums, skin, or vaginal infections. Should I see a doctor? Absolutely see a doctor or provider if you have symptoms and suspect diabetes. Early detection and treatment is important. Also, you must see a doctor if you already have a diagnosis of diabetes. Regular follow-up appointments to monitor blood sugar levels are also very important. Complications of diabetes. Increased risk of heart disease, which includes coronary artery disease, heart attack, and stroke. Nerve damage, which is injuries to tiny blood vessels that can be caused by excess sugar. This causes tingling, numbness, or pain. And this can lead to loss of feeling in the affected limbs if not treated. Damage to blood vessels of the kidneys and eyes may also occur. Nerve damage to the feet. Cuts or blisters to the feet can lead to serious infections if not treated. These infections can lead to amputations of the toe, foot, or leg. Skin infections, such as bacterial or fungal infections. Hearing problems, Alzheimer's disease, and depression are also complications of diabetes. Complications of gestational diabetes. Complications in baby include excess growth, low blood sugar, type 2 diabetes when the baby is older, and possibly death. Complications in the mother include preeclampsia, which is a condition that includes high blood pressure, excess protein in the urine, swelling of legs and feet, life-threatening complications for mother and baby. Subsequent gestational diabetes. It's more likely to occur with the next pregnancy also. After having gestational diabetes, you are also more likely to develop diabetes as you get older. Diabetes prevention and treatment. Type 1 diabetes cannot be prevented. Type 2 diabetes, prediabetes, and gestational diabetes can be prevented and treated by eating foods low in fat and calories and high in fiber. Eat more fruits, vegetables, and whole grains. 30 minutes of moderate exercise daily. And lose weight if you are overweight, but do not try to lose weight while you are pregnant. Medications are not able to prevent diabetes. They are for treatment. Insulin comes in short-acting, long-acting, and intermediate forms. Oral medications are also available. You may need more than one medication to control your blood sugar.